I am Dr. Kaite Udo Afa. I have been practicing anesthesia for quite a while now. I'm married, I have 4 children and a grandchild. And most importantly, why I'm here, I'm a unique survivor of the COVID-19, which many of us think doesn't exist. In the month of March, a team came from the United States for free medical treatment in Mexico. I happened to be one of the volunteers. We were all fine and no problem. And soon after the outreach, I came down. I treated myself for malaria. And the symptoms appeared to have abated, but it was coming, whining and wailing and all. I didn't understand. I was wheezy. I've never been an asthmatic. I lost appetite. I lost sense of smell.
I was part of the outreach that occurred in March, sometimes in March, 9th to the 13th of March, and I noticed some symptoms that were pushing towards COVID-19. When I told people, called colleagues, they were thinking I'm crazy. Where did you get it from? You didn't travel, you have stayed in Uyu. How managed you got this?
Even at this time, there was no case in Akwa Ibom State, and nobody believed in Akwa Ibom State that there was.
So it was actually when we got the news that one of the foreigners, US-based nurse that came in to assist us to volunteer for the mission, and was tested positive on arrival in the US. That is what rose my index of suspicion.
I didn't actually need a test to know that probably this is what I had. So I felt maybe 99% of chance I have the same thing.
That was one of the worst times in my life because it took about 2 days. The sample was collected on the 30th of March precisely, and the result came out very late on Wednesday, the 1st of April. I was quite anxious. I was even waiting. The days were so long, the nights were so long. I was actually waiting for a clue. But when the result came out, actually, since I had made up my mind, it could either be positive or negative, I accepted the result immediately and I moved on.
When I had the information that somebody in the United States that we related was tested positive, I was afraid. Because seeing what has been going on in Italy, people dying, I was terribly afraid. I was imagining, I said, me and my husband will lose 2 people. That I'll be gone, my son will be gone. And there were so many things on my mind. And I even extended to my granddaughter because without knowing, we had gone to visit her, visit my son, pick the child. So I said, it means all my family will be gone. I was afraid initially, but by the time the test result came out, I had already developed confidence.
As human, I felt, wow, COVID-19, very deadly. Killing people in the US, killing people in China, killing people all around the world. This is wonderful. Coming to Nigeria, me being positive, the first index case in Akwa Ibom State. As a human, I was afraid and scared. I was going to die. I started thinking about my kids. I started thinking about my wife who's going to take care of my young children. And you know, with time, I just realized that the mortality rate, what is happening in Lagos and Abuja wasn't that much. And we had some chances of survival. So I made up my mind that with God, I'll be able to put myself through this.
I'm somebody that really believes in God and what the Bible says. I had the confidence, God gave me confidence that nothing is going to happen to me, that this sickness is not unto death, but probably I had it or it happened to us so that it could be an eye-opener to our people, to help our people. Immediately the result came out. The head of public health in Akwa Ibom State called me and said, "Ma'am, the result is out. You are positive and your son is positive." At this time, my mind was already settled. So the fear was gone. Then I said, well, we'll go and let's see how it works. So but I don't regret, the step I took. The isolation center is okay to me. I think the government and the team have done a good job. Actually, I would say that we were like the pioneers, maybe the guinea pigs, because nobody had ever been isolated that way. In the initial phase, there were things that couldn't flow, and the caregivers, I would say people make mistakes, but they came to apologize, knowing that we were in isolation and depression and things like that were bound to come in. But I would say on the whole, they did very well. They were able to communicate with us. The things we needed were provided, and I would, in a nutshell, say it was a home away from home.
That's isolation center. I got a call on the morning of the 2nd of April that the ambulance would come for me. Well, it's should I say they came kitted, but what really helped me was I'm a doctor and I've been having a series of ambulance come pick me at home to go to work. So people in the environment did not really know. But it wasn't a sin because people in the environment didn't really know. They thought that it's a normal way of coming to pick doctor for surgery. So I was taken in an ambulance to Ibom Specialist Hospital where I was isolated. And when I came on presentation, initial lapses on the first day, but everything normalized on the second day, and my stay here has been very perfect. And I've really enjoyed my stay in Ibom Specialist Hospital. The most important thing I have to say, two things really keeps us here, and that's why in other centers you hear isolation center, people are escaping, running away from the isolation center. It's because of how the isolation center is. But the most important thing here is that we have that privacy and confidentiality. You don't know what is happening in the next room, and you don't even know who is in the next room. And most importantly, constant light and water. In short, I have never seen an Akwa Ibom, a US in Akwa Ibom that is like this. No blink, NEPA did not take light, and nothing happened.
COVID-19 is real. I know I've spoken with some people personally, and they don't seem to believe. It is real. If you start having the symptoms, it's not funny. You feel as if the world is on you and you are gone. I think what I would say to anybody is that we should try and prevent, because this COVID-19, more from the aerosol, that is from the breath, it can come in. And when I left that place, I told myself I will wear mask whether people laugh or they don't laugh, because everybody is a suspect until proven otherwise.
Let me talk about some facilities we had here that I did not expect to see. Yeah, the first thing that shocked me was that we had televisions in all the suites. Yeah, I call it suite because it's as if we are in house arrest. The only difference is that you don't leave this room. You just stay at the confines of the room without going in. We have television, you can see the internet services, and even the televisions, they are DSTVs. And you see, like now, I was working on my research. This is my laptop connected to an internet Wi-Fi that is with everybody in the place is connected to. And I do a lot of works, I read my books, I do my projects, and that made our life here. You watch movies for people that love movie. You watch a lot of movies, it makes our life here so easy. And I want to give kudos to the Akwa Ibom State government, because I know without them this wouldn't have been possible, and also for the team, because I know it took them time to really arrange this thing, but at least they made it a place worthwhile for staying for us.
When we tell people the amount of money we spent on medical equipment, people didn't know a day of like this will come. So we don't just react. I think we put things in place to take care of the health of our citizens, because we love them and we also appreciate every single life as important as the life of a government.